we've got a wonderful stand-in with not only our senators standing behind us, but Senator Dean Burke, and I'll call on him at this time.
Thank you, Irene. Appreciate you being here and making those opening remarks. Thank y'all for coming. First of all, I want to thank the governor for signing Senate Bill 180. As all of you know, Senate Bill 180 was a bill that originated originally in the House with Representative Jeff Duncan, who's here. As things tend to do around here, that bill had some issues coming across, and so we started it out of the Senate, and we made some sausage as we usually do. Trey Kelly carried the final version in the House. I want to thank him. He's somewhere around here. But again, there is a lot of folks right now that are very interested in rural health care, including the Lieutenant Governor, Casey Cagle, who couldn't be here today. Last fall, he appointed a group called Healthcare 180, which is a group of business people and community leaders that main function was to energize the business community and the people of our state to help support rural hospitals. So basically to publicize the importance of the communities taking advantage of this tax credit and getting the corporations in our state who do a wonderful job to increase the numbers of donations. The tweaks that we made this year hopefully will increase the level of support, and I'm confident that it will after having a lot of conversations with the business community. The Rural 180 Task Force, in addition to marketing the tax credit, have been charged with working together with all of the stakeholders, and a lot of them are here. Jimmy Lewis is with Hometown Health and the Hospital Association folks. Monty's around here somewhere. Georgia Hospital Association people. Everybody that represents the provider and stakeholder groups in rural Georgia have an important place in this conversation. And it's not, as all of the controversy that's going on nationally about health care, it is not an easy subject to get your hands around. And we have to look at every potential source of revenue and changing business models and all of the other pieces that go into this have to come together, because there is no one easy solution, or we would have found it already. In addition to the Healthcare 180 Task Force that was charged last fall, Lieutenant Governor Cagle, during the session, has put together a Senate Healthcare Reform Task Force, and several of those members are here with us today. Renee Unterman, Chuck Hofstadter, Jack Hill, our majority leader, and Ben Watson, Dr. Watson, colleague, a physician colleague in the Senate. We are being charged with looking at what's going on in Washington, looking at what's going on in our state, and coming up with some recommendations that will guide our state in the next year, looking forward to the next session that starts in January. What is it that the state can do that we're not doing now to improve both access to care and quality of care? Frankly, Georgia ranks 49th out of 50 in a lot of health measures, especially in the rural areas. And as part of the solution, we have to focus on the patient. The patient's going to be the center of what we have to do. And if we don't include that important piece, if we just look at finances, we're not going to solve this problem. I don't think this problem can be solved in Washington. I don't think it can be solved here in Atlanta. It's going to be solved in the communities of Georgia, one-on-one with patients. But those provider groups have got to have the resources in order to do what needs to be done. So that's what the task force is looking at, is what else can we do to help those people on the front lines to do a better job. Senator Unterman has been dedicated with discussions about mental health, and that area is obviously a big focus. Patients that are having mental health disease almost always have poor outcomes. We're talking about their physical health as well. The rural access issues and hospital stabilization obviously is a big piece. The hospital stabilization task force that has done its work for the last 3 years. There's been a lot of learnings from that and a lot of good things that the rural hospitals are now embracing, such as the EMT health delivery. And one thing that I wouldn't have thought was a problem, but we have a lot of silos in the rural communities with healthcare delivery. There are different pieces of healthcare delivery that aren't talking to each other. And so that was identified early on in that rural hospital stabilization committee, and a lot of communities now are having conversations they've never had about who can do what, where, and the best way, utilizing telehealth and a lot of other new technology. So the bottom line is the Georgia Senate is dedicated to improving the financial health of rural health care. It's dedicated to improving the healthcare system delivery as a whole in Georgia. And we and the members behind me here are all using our time and our energy to work together with all the stakeholders to make improvements. I'm delighted here today to have Alan Kent, who's the CEO of Meadows Health System in Vidalia. And we're going to let him say a few words about the challenges that he faces every day doing the great work that his organization does. Alan?
Thank you, sir. I don't think anyone here needs to have any refreshers on the plight of our rural communities, and especially the plight of rural health care. These are some of our most vulnerable populations throughout the state, throughout the country. And as Dr. Burke mentioned, these problems are not problems that can be solved on a grand scale. They need to be grassroots opportunities to think about and to come up with solutions and to try things. I applaud the task force for the great work that's been done so far, because those are experiments to see what we can do to change the way we think about healthcare. And instead of looking to Washington or looking to Atlanta for solutions, we have so many great and dedicated physicians in our community, so many other healthcare leaders, so many doctors, nurses, dedicated people in our communities. And we have our senators and representatives that are looking at those things and looking for the opportunities to find the successes so that we can emulate those in other communities. Down at Meadows, we're a rural hospital. We have a good fortune of having some up-to-date technology and a fairly new facility in our community, but we struggle with the same things that every other rural community has, and those are those issues that are endemic to their communities. We don't have large manufacturers who ensure great numbers of employees in most of our communities. We have very dispersed populations, so people are very remote from their physicians and their hospitals in most situations. So when this bill came along last year, we saw this as a great opportunity to engage our local population. This is a chance for people in their local communities to have a say about what happens in healthcare, and specifically to participate in the operation of their local hospital, rather than waiting for a tax issue, looking for an opportunity for a grant. This is a chance for people to step up individually and for corporations to step in as business leaders and be able to make a difference in their very own communities. When we think about healthcare, it's been observed many times that healthcare is truly a local phenomenon. So when hospital boards and hospital physician leaders and local business leaders get together, they can have an effort, they can have an impact that will truly make a difference. At Meadows, we've had some really good success, even working on the tenets of last year's bill, which was only a 70% tax credit. And that gave us the opportunity to go out and find several dozen donors who were quite willing to jump in and make donations to our hospital. This year, with the improvement of that bill to a 90% tax credit, we're going to immediately be able to go back and do some more work that's going to greatly benefit our organization. And I see the same for most of the communities around us. That might not seem like an awful lot of money when you're talking about even a small hospital having a couple of $100 million that floats through one way or another, but there's so much indigent care. And the bill that's sent out, as you probably know, is almost never what the hospital receives. So when we look at the high rates of indigent care, when we look at the shortfalls from Medicare and Medicaid, and we look at the small infrastructure that rural hospitals have, there's just not a lot of room to make up the difference. And this bill represents a real opportunity that in many cases could be the difference between success and failure of a rural hospital, between profit and loss, between having equipment that's aging and having equipment that is updated to offer the same kinds of care that physicians want to deliver in small rural communities as is delivered in the more affluent urban communities. So thank you all for your great work on this. Thank you to Governor Deal for signing this bill, and we look forward to great opportunities to continue to have an impact on our local hospitals.
Alan does a great job with his facility, and there are a lot of great hospital CEOs that being a rural CEO, being a rural physician, rural provider of any sort is a mission. The financial rewards of providing care in rural Georgia is not anything like it is in the metro areas. And so the folks that are doing that work every day, it truly is a mission for them. And the improvements in their community and the health of their community is vitally important. The changes in Senate Bill 180 to make the tax credit more attractive, I think will just add to some of the momentum. I want to thank the Speaker for his development of his rural-focused task force or group this year that's working on rural issues. Economic development in a rural community cannot occur if we don't have a stable healthcare delivery system. And so those two things go hand in hand. So we need new factories, new jobs in rural areas, but we can't attract them. We don't have a healthcare system that will allow their workers to feel comfortable that their health is taken care of. So these issues resonate with each other, and I want to thank also the Georgia Chamber for making rural issues one of their focuses for this year. It's nice that people are talking about rural Georgia. We would love for that not to be an issue. I'm a native rural Georgian and I'm very proud of where I come from, and I want that type of community that I was raised in to be there for my children and grandchildren to enjoy as well. And it's not going to happen without hard work from people like those that are present here, and I also want to thank everybody for your attendance and your hard work. And definitely want to thank my Senate colleagues behind me for their support in this important issue. That's the end of my remarks. I'd be glad to take questions if there are any. All right. Thank y'all for coming.